I think the broadcast has officially begun. Welcome everyone. Good afternoon. Thank you for spending your lunch hour with NK and our esteemed panelists. We're excited to bring these panelists together and kind of further the discussion on the changes and the future directions of where senior living is taking us in these very different and challenging times. To start with, about 6 weeks ago, this group of people got together and were trying to pinpoint a date on the calendar. And when we looked at December 2nd, we thought, you know what, that could be a real changing time for everyone. Might even have, information on when a vaccine might be released. And lo and behold, in the past 6 weeks, that has happened. And I think there is, in some circles, a different feeling in the air with respect to what the next months will unfold. So we will say that this discussion is both dealing with now, but really looking more hopefully towards the future. And I think the people we brought together today really are all future focused. The pandemic will dissipate. That's the best thing we could say. But the virus isn't going anywhere. The virus will be with us. How we change and adapt facilities and prepare for a better, safer future for our elders is really part of that. So in a minute, I will have everyone introduce themselves. I will say, by way of how we assembled this great group, we really wanted a cross-section. Not on screen right now is Toni Lynn Davis, who represents long-term care. She's a great client of ours, was the first greenhouse project in the state of New Jersey, representing the life plan communities, Brian Lawrence, and representing two different sides of the design field. Esther Greenhouse is an environmental gerontologist, and John Urban is a mechanical engineer we work very closely with in terms of shaping environments. And what to me, getting such different voices at the same table is really of great value when it comes to shaping how we're all going to go forward. So I will say, by way of this conversation, I hope it's a very hopeful one. It's in recognition that this incredible time we're in is simply an accelerant of changes that are coming anyway. When change comes, we react. The world reacts in every human capacity. And then I think we need to regroup and figure out what are the best things we could do going forward, and what are the things we, out of that pure reaction, that we need to tamp back down, that we need to get beyond. And that involves everything from how we operate day to day to what future regulations will come upon us. So with that, I'd like the panelists to kind of give a little bit more of the background and their focus. And since Toni, you're not on the screen, we'll start with you.
Oh, sure. That's my punishment.
No. You're the voice beyond.
As Dan said, I was in a community in West Orange, built the first greenhouse homes in New Jersey. Very proud of them. However, I have moved on. I now work for a hospital system in Freehold, CentraState, and I run the long-term care skilled rehab unit on campus with the hospital. We have 123 beds. We had a very large outbreak back in late March, early April. To date, we have no outbreak, and I'm knocking on wood for that. But I know the hospital is full and diverting every day.
Esther.
Hi, thank you so much for convening this discussion. I'm Esther Greenhouse. My professional purpose is to enable people to thrive by design. As Dan mentioned, I'm an environmental gerontologist, which means I specialize in how the built environment affects the functioning and well-being of older adults. But I'm also a built environment strategist, where I use my expertise in design, environmental psychology, and community planning to help organizations leverage design features to enable people to thrive. I do this work in a variety of ways, such as being a consultant on the nation's first elder-focused emergency department. I've also consulted for CCRCs, advising them, training their staff, and so on, and developing innovative initiatives that are focused on how the built environment can benefit people, such as the current Equity by Design initiative with AARP International. And we'll be sharing the link to that and other resources through Dan.
Thank you. Brian?
Sure. Good afternoon, everyone. I'm Brian Lawrence, President and CEO of Fellowship Senior Living. First, of course, thank you, Dan and NK, for pulling this together. This is a great opportunity to learn from this crisis health pandemic that we have in order to make a difference for all those we care for and serve. So thank you for this opportunity. So Fellowship Senior Living is a full service provider of senior services in New Jersey. We have a community called Fellowship Village in Baskin Ridge with the whole continuum of care, life plan community, independent living to assisted skilled memory care, inpatient, outpatient, rehab, and we have Fellowship Medical Group, where we have physician practice both on site and off campus as well. And then we have a home community-based service division, which includes home care, hospice, therapy in the home, and long-term care plans as well.
Thank you. John?
Pleasure.
Good afternoon, everyone. Thanks for attending. I'm John Urban, President of Johnson & Urban Consulting Engineers. We are a 20-person firm located in central New Jersey, offering full-service consulting, engineering, HVAC, electrical, plumbing, fire protection, internet technology, audiovisual. I myself have over 30 years of experience in the business, with a significant part of that in healthcare. That's one of the sectors that our firm is heavily active in, as well as many others. Healthcare is one of our strong points here, as well as within that envelope is senior living, which you work closely with NK in this case. We currently have a large 300,000 square foot senior living center, almost completed in design in Totowa, New Jersey with NK. Thanks for having us.
Great. As we get into, we're going to shift into some questions for the panelists, but just by way of housekeeping, if the attendees watching have questions specifically for a panelist or for in general, please put them in the chat. I think there may be two different places to put on this particular interface. There may be a questions area or just chat. Please put them in chat, and we are being assisted here today by people behind the scenes at NK, who I would like to thank by name. Jacqueline Schwartz is our active host right now, and Susie Gensler is actively, she will be filtering some of the chat questions. I will say, if we don't get to an answer today during this meeting, we will certainly look through the chat area, and we have everyone's contact through the registration. We can follow up there for appropriate feedback. So with that, I'd like to shift into some questions for the panelists. We've arranged these again. You know, this is the theme today. If we could, or my hope, and we hope it played out this way, is you know, during normal times, we work in an arena where we function many times on best practices, and change agents such as Esther and the culture change movement, you know, question what best practices are and try to get to better practices. We're in a time of great try things and see what works, but we really need to round the corner and look for what the new better is. And we're really kind of, so I hope some of that comes out today. We have a couple themes for questions, certainly starting with the resident experience itself. That's always a focus of our design and what everyone is trying to provide for the elders. Theme of the business of senior housing, the rules and regulations around it, and certainly the aspirational view going forward of how do we keep engaged to a better tomorrow. So with that, I'll start with the first question to the operators among us. You can fight amongst who wants to begin answering, but I think it would be great to hear from both the continuum care and the skilled side. The pandemic forced deep isolation for all residents. What mitigation measurements have certainly been taken to decrease this isolation that the residents feel. But what measures to decrease in isolation and increase social contact that you've done do you see have lasting power in your communities past the pandemic? What positive interactions to fight isolation have come about, if any?
So I'll take that, Dan. So for us, we created a what we call fellowship studios, live streaming content for our residents throughout the whole continuum on campus. Whether you're in independent living or in the health center, the assisted skilled or memory care, people can tune into channel 593 and get live content at various times of the day. From exercise class to entertainment to a lecture to a discussion on a specific topic. We've live streamed other content, not just from us, but from other providers, and funded it through that channel as well. It's been a huge benefit to engage people. We had like discussions where dial-in number where they could call into the studio and have discussions and questions. That's really helped really pull the residents together and the team together to really engage one another during this pandemic. And I expect that to continue and to have quite a bit of lasting power beyond all of this as well.
So you've really multiplied that in force in terms of probably previous community techniques would have been recording an event where most of the people were expected to have been in the room watching it and then replaying it for those that weren't. And now
right.
it sounds like you've scattered live streaming cameras throughout your entire world. So I guess that has some design implications, right?
Right, and we have a specific location that we created as a makeshift studio where we have backdrop and the staging, the set and everything else. So we actually had a functioning place. But speaking about though, in various design, when we design other locations at which we're planning now, we are planning and making sure we set up cameras that can live stream future programming events in other spaces. So that's what I'm saying. This is very long lasting for us. We definitely feel that we'll be streaming live content for the foreseeable future, because people don't always want to come out of their home or go into a community with others, especially those people in the health center that are more compromised. So to get some live streaming content to them, it can be very engaging and really resonate with those individuals.
So on the in my area, I'm an old time skilled nursing where I have a lot of semi-private rooms and the long hallways. The use of Skype and FaceTime has been, great, and that I can definitely see will continue because the residents are having the chance to talk to people or family members that they didn't normally see on a regular basis, regardless that visitation was curtailed. But now they can see them. And also the involvement of Facebook is really big now, where we can actually put it on the big screen TV and, they social distance apart and they can see each other's family members and what they're doing and, what the kids look like and the animals. They get to see everything and talk about it and explain it. So I know my activities director is working diligently on how she can create an activity going forward that would, incorporate FaceTime for the residents to continue to use. So I think that those kind of technologies will definitely move forward. And if I was to redo my building or some parts of it, I would make sure that those technologies are a part of it.
So you've developed new ways for people to brag about their grandchildren.
Correct.
Through Facebook.
Yep. Yeah, their kids, their grand dogs. You'd be surprised.
Yeah,
Grand pets.
that also has design implications going forward for sure. And Esther, have you encountered any other strategies similar to these or different in terms of increased isolation?
Definitely similar things as to what Toni and Brian have been describing. And I was really smiling listening to these stories because there's been a lot of concern over the last 10 years about how much time people spend on screen time and the detrimental effects. And here it's turning out to be a lifeline for so many people. So one of the things, though, that I think continues to be a huge issue, especially in rural communities, is broadband access. Depending on the reports you read, up to 50% of people in our society don't have adequate access to broadband for a variety of reasons. So that's still a huge an issue we have to face, and we really have to recreate the Rural Electrification Act of 1936 in terms of an aggressive nationwide broadband program.
Right. The one of the the recognition points on just how isolating the pandemic has been. Do you see this changing the way the industry and even the American culture speaks about social isolation and the need for increased connection?
Absolutely. One of the advantages of this really difficult time is that it's shining a light on issues that have been present for decades. And the design and protocol of care of senior living and at home and in community options or services must consider the psychological and emotional well-being of the residents. And fortunately, everyone has now experienced what it's like to be quarantined, isolated, removed from society and your loved ones. And this firsthand experience can only bring greater empathy to our work. So we can't simply rely on this automatically to be translated. So I recommend that we intentionally incorporate strategies. One example we talked about waiting in the pre-webinar were things like the greenhouse model, smaller groupings of units in a more family-like arrangement. And I would say from environmental psychology, we can look at a couple of key concepts and apply them. One is minimizing environmental press. And that's when there's poor fit between a person and his or her environment. We can minimize environmental press by leveraging our spaces for greater independence and personal autonomy. And then another thing we can be doing is layering spaces for privacy, applying varying levels of interaction, private, semi-private, semi-public, and public. So I really think that this pandemic, while it's been in some ways a horrific experience for many and at minimum a difficult experience for all, it's an opportunity for transformation.
That's great. Now, I think related to the environmental psychology aspect, again, to the operators, I'll point the question. For the longest time, resident-centered care spaces and community-focused spaces have, urged in many cases to be smaller and more home-like, and promote certain characteristics. So, be it, independent living has its own characteristic in a location because of the people it attracts and how those people interact with each other. Likewise, in a unique wing on a long-term care. So the question is really, how has the challenges of the environment? I think mankind wants to rise to their occasion and connect. But how within your communities, how have specific characteristics changed for the positive? The positive things we've seen, people coping with each other differently, or interacting differently, or inventing new ways to connect to each other? Have those ways shown themselves in your communities, or is it still mostly about coping? Anyone want to take that one?
Brian, you want to take it? I know you have a lot to talk about with your outdoor dining.
I'd be happy to. So yes, absolutely. You know, in light of everything been going on, even before COVID, especially during and subsequent to COVID, we were able to open up a third dining venue called the Wilson's Tapas Bar Lounge with indoor and outdoor dining, because emphasis on the outdoor dining. And I got to tell you, the residents, it couldn't come at a better time. You know, it opened up early October, right when it started getting colder. We had a makeshift dining seating right in the front of our campus behind me, through the window over there, which was okay, but not ideal. You know, it was under the portico share, and when people, you know, known people drive in and pick and drop people off. So it wasn't the best setting, but their dining venue that we opened up was wonderful timing. And indoor space is, of course, gorgeous, but aside from that, we can't use it now, but the outdoor space has been phenomenal. We have beautiful scenery behind us with 72 acres, a lot of wetlands and so forth. And there's a covered porch aspect to the Wilson's Tapas Bar Lounge that is heated, and also with ceiling fans too. There's heats like all throughout the top of the ceiling, and it raises the temperature of the space by like 20 degrees. It's been phenomenal during this process. Residents have loved it, and there was a buzz about it for the past month, and you know, they're very excited about that. In conjunction with, of course, the alcohol, they could drink and enjoy the outdoors at the same time. So that was a very nice feature to offer during this pandemic, and an opportunity to socialize and engage with people in a very safe, comfortable environment. So we have that covered porch that's heated, and then we have an outdoor patio with fire pits and those, you know, stand-up lamps that you would see like on patios as well. So we've been using that space quite often, and the residents have really enjoyed it, and that's something that's going to be used immensely every night and going forward.
Yeah, I agree. The outdoor dining is definitely something that will last, even though I can't do it in the colder months. I can do it in the summer. That's about it. But we've also extended the outdoor to outdoor movies, which they like, you know, the drive-in kind of deal. But that I can definitely see going forward, the outdoor dining, not just for nursing homes either. I know a lot of people who prefer outdoor dining, you know, out in the community, more so than the indoor.
Yeah, I love it.
Yeah.
My town where I live, they blocked off a street where all the restaurants had the outdoor dining right in the street. It was lovely. I mean, definitely recommend it. We also have a theater, a cultural arts center with Mitchell and Saminsky Theater that seats normally 250 people, but during COVID, with the rules, you know, we could fit, you know, about, you know, 25 people safely, 6 feet apart when masked. So we've been utilizing that during this process too, for movies, entertainment, and different venues for our residents. And that's been very successful as well.
So Toni, being in a, I mean, the outdoor dining that Brian just expressed, he was lucky that that was in the works prior to the pandemic, and now has a new amenity. It seems that I'm guessing in your existing, you know, the outdoor will become a priority in terms of, you know, interventions over time, as a concern that's not going away. But I guess you have had to do more ad hoc interaction with the residents.
Yeah, we have a courtyard that we utilized to create that outdoor dining. Even though, you know, we've had things out there before, and snacks and things like that, but they've never actually done meals out there. So that was, you know, it was a way to open up that box so that, you know, it's something we can carry forward, and we definitely will.
Yeah, I guess related to the large gathering spaces, quick question to John to finally bring him into this. Is there have you faced questions for large gathering spaces to make them safer at this point? I know in the work you and I are doing, it's mostly about the private and the semi-private areas to make it, cleanable. But what about, I think everyone on Earth is concerned about large gathering spaces going forward.
Sure. The day will come where we'll all be able to gather indoors again in large groups. Hopefully that's sooner than later. When we design these spaces, from a ground up point of view, a large space, well, that's a lot easier than an existing space. We have a lot of tools available to us. We can size the air handling equipment for more efficient, deeper filters. We can have space for them. We can size fans and motors to accommodate more airflow. We can have the ability to pre-purge the space with air and post-purge it after occupancy. There are some technologies that we already implement in a lot of our designs. One of them is called bipolar ionization, where a space is flooded with ions that combine with bacteria and viruses and render them inactive, where they are later trapped and taken out of the airstream by filtration. It's been shown to be very effective against the known viruses that are out there. It is a low energy use product. It's highly effective. So we would employ all those things. In an existing space where our hands are a bit tied and we're working within existing equipment, some of those things aren't available to us. For instance, a lot of our clients call up and, we want to add deeper filters. We want MERV 13 filters. Well, that's just not always the case. There's a limitation to the equipment, what could fit in there, what kind of horsepower we have to move the air. We could actually be doing more harm than good. But this bipolar ionization device is retrofittable to many existing pieces of equipment. It's small in space, very low in power usage, and highly effective. And as a result, these units are selling, like hotcakes. Everybody wants them. They realize the value of them, and it's ironic, Dan, that when this device first came out years ago, it was aimed to reduce the amount of outdoor air. It was put in to clean up the air, deodorize it, and as a way to meet code and drop outside air. Now, fast forward to 10 years later, here we are looking to use that device, but actually increase the airflows and have more air changes.
And without getting too geeky about it, is the principle, what little I know about it, is that you are electric charging particles, dust and other things, so that things like viruses cling to them and drop to the ground? Is that what happens?
Oh, they cling to it, and it makes the molecule larger and eventually be trapped by the filter when it makes its way through the cycle. And in fact, it can make a MERV 8 filter perform like a MERV 13.
Yeah, I will say as a preview as we go through this, a lot of the questions written by the audience are all around HVAC design. So we may actually need to have a separate panel just with the designers on this. So shifting a bit into the rules and regulations. We don't know where things are going. The incoming administration has noted that they want to have certain focuses on infection control. And I think, that's kind of certainly an easy and pervasive topic to put forth on how those changes actually become from recommendations to actual regulations. That will unfold. So I guess what applications do you see this presenting itself, and even outside of other regulations with infection control, and do you see wide changes in operation, in staffing and cleaning, or just better application of it? So I guess, I don't know if Esther or Toni want to start.
Toni, you want to go ahead and I'll follow?
So it's changed a lot already in our practices. So we actually bought a system that it's like a Clorox 360 that cleans in a certain way a room that is was COVID positive. They also have the UV lighting. You can bring in the UV lighting and clean a room that way. I think these things are going to be part of our norm even after this pandemic.
And in your facility prior, you did not use either of those systems?
No, never. Didn't even know about them. Okay. So yeah, it's and also you know, the bringing to the forefront the hand sanitizers. You know that you need more of them, and they need to be everywhere, and for people to use them. You know, so you know, designing a better, I think, way of having that available, that it's not so antiseptic, is important.
Yeah, the balance point for us, you know, NK Architects does a lot of acute healthcare environments where the very material choices you make in a normal, you know, for infection control prevention in a normal day pre-pandemic anticipates being blasted with massive amounts of UV light, and our residential areas in many of our buildings don't necessarily anticipate that as much or as well. And I think going forward, even just a regular flu season, I think there's going to be a shifted cognizance of operators to either use, you know, make the more Clorox, you know, make the materials in rooms more, you know, Clorox or UV light, you know, penetrating. Esther, are you seeing talk or research on either zoning of buildings or how to protect contaminants from elders as a strategy?
Absolutely. And I think that a couple of things really need to happen going forward. One is operators like Toni and Brian are having firsthand experience with making a shift in how things are done. But I do think it's really important that there are regulations to make sure that over time, as the urgency leaves us, that we're still maintaining these levels of cleaning. And I think that as well, there are we have to go with the current models, but we have to be reimagining what could be in the future and how we can shape things, and certainly making it easier for people. So I'm going to see if I can find and share this link also of it was actually a master's study. I'm an adjunct at Cornell's Design and Environmental Analysis program, and one of the students did a great study about making it easier for staff in a healthcare setting to use hand sanitizers. It was really informative. I'll share that. And then the other thing is feedback. You know, when people get immediate feedback, for staff, for example, get immediate feedback on their compliance with using hand sanitizer or washing their hands, the compliance rate goes up significantly in a very short amount of time. So again, a lot of the things that positively impact people's behavior are behavioral techniques and components of environmental psychology that we've known about for decades. We just need to look at them in a new light as valuable resources for new situations.
Yeah, it makes it easier for staff to be compliant.
Exactly.
Right. Yeah, Toni, I think you had said before the cameras were rolling, compliance only happens when it's easy. And I wrote that down because, you know, for the designers, we really have to stop and check and ask, are we making it easy? Are we making the measures around us, including, you know, thermal comfort control? You know, do we make it easy, you know, easy to make, you know, for the elders, or more difficult? So that's a great point. Here's as related to regulations and what's coming out, there's a popular audience question that's been asked a couple of times, and I think it's just the curiosity of the moment we're living in. Has vaccine distribution preparation already, are those already in the works in your communities for your people?
I can cover that. I've been connected with this for months now with local and state health officials. As we heard, the vaccine is coming. It looks like in December. CDC just gave their guidance yesterday that they recommend it go to frontline healthcare workers and long-term care organizations like assisted skilled life plan communities for the first wave, starting this December and then going forward. And we've been in preparation. We actually were well aware of the cold chain management of the vaccines, the minus 70 degrees Celsius for Pfizer, minus 20 degrees Celsius for Moderna. We actually installed back in October both freezers on our campus. And we also put out there to the state as a potential pod site to vaccinate not just fellowship, but the greater community as well.
Yeah, that's great. That's a great investment in terms of understanding that vaccine. I suspect that the ones that must be kept super cold will be used in bulk locations like that.
Yeah, we're just looking for a place to do it.
Right. Yeah, which is a hurdle in itself. Also in the kind of rule and regulation category, a question to start with John. In terms of, you're already quite regulated in the acute care and skilled nursing environment through both NFPA and Energy Code. Do you see the push for some of the measures that you were just talking about? Will that push us to change the Energy Code in relation to hospital and acute care and subacute care environments?
It could very well, Dan. I mean, look what history has showed us. Back in the 70s, we had an oil embargo. Energy costs skyrocketed. What did we do? We sealed up our buildings. We changed windows. We closed our outdoor air damper. 10 years later, we found out we had a term thick building syndrome. Enter ASHRAE. We needed to ventilate our buildings, and we put all that in place. Now, 10 years later, we were actually looking at ways to how can we introduce that outdoor air and control, our energy costs because they're still high. And here we are 10 more years, we're faced with a pandemic, and what do we put into our systems that could protect our occupants and our loved ones, without, and be mindful of the energy costs of these things. So moving forward, as you know, codes have, been more and more stringent each edition about energy. They command the industry to make more efficient equipment. I mean, that's how time evolves. We're at a point now where we need to potentially use more energy to put these measures in place, or at least to have the capacity to put these in place should they, need to be enacted. You may not in COVID times, yes, your systems are operating in X. Well, maybe the pandemic is over and things relax someday, and we don't need to run them at that capacity, and and energy usage can back down. But for sure, fans are upsizing. Heating and cooling is somewhat upsizing. We're using other add-on devices that all affect energy usage. So this has to come into play. ASHRAE is our leading agency for that, and they've issued some guidelines, particularly for healthcare and for schools that the public is, using as a tool to investigate and ask their institutions, what are you doing to protect our loved ones? But that takes a long time to make it into codes, as you know. So we're really at its infancy, and technology, will be things. There's things that we know now, and there's things that we don't that could come out tomorrow. For instance, we're exposed to a light fixture that is in the room that you might think is an ordinary light fixture. However, when you leave or you turn it off, there's a lower level UV light that comes on that's not harmful to your eyes that can disinfect everything that it sees in the room, surfaces and the air. So it's an exciting product.
Yeah, it's a good setup, I think, for additional dialogue. Because I think what you just put on there is, let's not discount innovation, right? And innovation will come along, and let's assume that those factors on the table about health and fresh air, infection control, those will naturally be the hot potato topics for designers and regulators to move through. And so we probably will see at least both all of your previous examples of the 70s oil embargo. There was a reaction, and then the natural overreaction and the counter reaction. So we're now at the time where hopefully we can learn from each of those decades of experience and wrestle with this to a better place. But I think we can conclude that certainly there will be attempts, and we will be facing additional regulation and how we move through it. Shifting themes a little bit, again, just in the interest of time, the business of senior living. I think there's, to me, I'm interested in, there's a market perception and a reaction naturally when this happens, right? We want to make sure our loved ones are safe, or ourselves if we're thinking of moving and downsizing. So I guess, to start with Toni, when you get calls for placement, what are the questions different that you're being asked now than they were? Or is it all just the reactionary safety measures, or are people literally looking for, they want to know how you operate more closely?
Basically, the first question is always, do you have any COVID in your building? That's pretty much the first question. And then after we say yes, we explain how we manage it and how the infection control is set up in the building and the HVAC, and they get pretty deep into it now.
So yeah, people are, I guess you're needing to put a value proposition on what your operational procedures are.
Correct. And also, the guidance that's from the state, people don't understand that, that we're mandated to do certain things. So, their first idea is, well, listen, I want to come in and visit every day. And if I can't, then my mom's not coming there. Well, okay, but any nursing home you go to is not going to let you come in and visit. And people just don't get that. I see Brian shaking his head. I know he's going through the same thing.
Yeah, Brian, how is when people, you're on a tour or a virtual tour, or you're talking to interested people coming in, is what they're looking for changing a little bit?
In general, they're still looking, well, it depends, independent living versus health center, assisted skilled and memory care. Independent living, of course, they want the community, maintenance-free living, peace of mind. But of course, on top of that, of course, there's always a focus on COVID. How have you managed throughout this pandemic? What are your precautions in place? There's always those questions around that, absolutely. And we've fared very well. So that's been very successful for us. We've had since June, we've had 20 move-ins to the independent living side. So, and people have really been very receptive of what we put in place and how we've handled it and what things we have planned for the future. But there's been a lot of discussions around safety for the residents.
And Dan, I never thought I'd hear it before, but there definitely is prime time real estate with a parking lot view. Because when there's no visitation, people want to see. And I mean, we had to label all our windows with room numbers so that people knew where their loved one was. And even now they're at the windows daily.
Yeah, that's it's a telling sign. But hopefully we won't be only building one-story buildings with on parking lots, but perhaps balconies. I saw a lot of Italian uses of balconies visiting from above.
Just to talk about the visitation. Visitation is allowed, assuming there's no outbreak in your community, for the health center side. Outdoor visitation, of course, you could do in a safe environment. We've been doing that during the nice weather. We do have indoor visitation. Again, communities can do that when there's no outbreak, when you could have a central location where you could clean it between visits and you can manage it and keep people 6 feet apart. Again, wearing masks and make sure it's safe and screening them before they come in and visit their loved one. But you can have indoor visitation per the guidelines from the state.
Right. So is there an active back and forth with the guidelines in terms of challenging certain things that have come out? Because all of these are new regulations from the state.
Correct.
Has the industry had to push back that some of them are not as effective, or is there a balancing act?
No, from the industry perspective, I think they're right on from the outdoor visitation and now the indoor visitation that they put in place. I think it was last month they put it out there. But as it was getting colder, maybe it was 2 months ago. So that's been very effective. Of course, the family members, there's pushback from them. They'd rather spend much more time with their loved one in person. Now we're limiting it to like 15, 20 minutes so you could cycle people through, clean between visitors and so forth. So family members don't like that. There's pushback from that. Well, I want to spend 2 hours with my mom or dad, or as long as I would like to, like before. And unfortunately, we can't accommodate that because we have to make time for other people. And of course, it takes our team members time too, to take the residents, take them in the room, clean between each visitor. And you can't do it every day because these are basically a life enrichment team and they have to go and engage the residents. So, you got to do activities and engage them and keep them active. At the same time, they're trying to set up the visitations with the families and the residents at the same time, so there's a balance to everything.
Yeah, that's a great description of what the balancing process is. So hopefully we'll have a couple time for some audience questions, but I do want to kind of conclude and have each of the panelists kind of address a more aspirational question, which is, as new light is shed on how older adults and residents live in community, what is the most important design and operational goal that we should focus on now that allows residents to thrive and the care team to thrive? So again, it's balancing, but what as we go forward, instead of just looking at safety or just looking at community or just looking, how do we, what's the hopeful? Esther, you want to start with that, perhaps?
I would love to, because my professional purpose in life is to enable people to thrive, and I actually developed the enabling design approach to help organizations do that, leverage the built environment to enable people to thrive. And one of the important components to this approach is understanding that the status quo of how we design and build in general, and there's some shift, fortunately, in senior living, but we out in the larger community, and to a certain extent, our standards, even in healthcare, certainly in healthcare and to some extent senior living, is that we design for the average height male with high sensory and cognitive abilities. And so we're essentially designing for the 20 to 40-year-old male. And it's important to look at our communities and our facilities and say, how many of our residents and staff fit into that? How many of the administrators even fit into that? When people ask me for a definition of what's an older adult, I say 40 and older, because already in our 40s, we experience typical age-related changes to vision and hearing, which impact our daily functioning. So it's really crucial to limit what's called environmental press, which I mentioned earlier. And what our goal is to create optimal fit between people and their environments. And when we look to be more inclusive and have design that helps people function regardless of how tall they are, or what age they are, then we enable greater independence. And we can see that it will benefit both the staff as well as the residents. So that's why I focus, when I do workshops, for example, in senior living or healthcare environments, and sensitivity trainings, I make sure that we include administration and even maintenance for everyone to have a better sense of what the staff faces when caring for the residents, particularly the aides, and also how the residents are struggling in spaces. One of the things that I see so often in hospital environments or where more intensive healthcare is provided in senior living is the struggle for staff to provide care in rooms and the need to move equipment around, move furniture around, and those are struggles that we can certainly address. So my call to action, again, going forward, is to have this paradigm shift. How much more can you get out of your environment to give to all of your people to enable them to thrive?
Yeah, the point of I guess we're already in a staff taxed world, and what you just pointed
Exactly.
is design helping. You would ask us to have it so that it serves both at once, that we solve the design issues. If we're doing it correctly, we're also helping the already taxed staff, which is part of the balance.
Absolutely. And I think this pandemic has reminded us, it's helped to show the outside society how much senior living and healthcare has been struggling with having enough staff, and all the different variables that are working against staff to provide care to our loved ones and to ourselves. So I'm hoping that this will create a shift where there's more emphasis on eliminating these barriers to functioning.
Great. Toni, you have anything to add to that?
No, I don't.
Good. Brian, any thoughts on that?
Well, sure. I mean, two things. I mean, from an operational perspective, thriving, and we talked about a little before, I think the household model, small house design, really lends itself for people to thrive within that environment. That's something we're doing on our campus, repositioning the entire health center, all levels of care, assisted, skilled, memory care, to the household model. And I could tell you the residents definitely thrive in that home-like environment because everything's centered around them, not the staff, not the institution. It's about the person. So from the health center side, looking into the household model of care, person-centered care is definitely the way to go. And also it's all private rooms too. So from an infection control perspective, it helps with that as well. From the independent living side, again, more amenities and services to engage residents outdoors in a safe environment, indoors in a safe environment, is also a way to help address the boomer generation looking for that type of environment that they're looking for today that's much more engaging and active. Great.
Yeah, that's valuable. We've got hopefully time for one or two audience questions. One is certainly it's top of my mind, so I'll take their question. What have you done, if anything, about staff entering the facility each day? So do they have an area for changing as well as cleaning before entering the residential zone? So have you had to do any ad hoc changes to your facilities to better allow what used to be, you could actually enter the zone without and then change, etc.?
So I'll start. So staff, and unless they're going into the COVID unit, are coming in just their mask, and that's all they need. If they go into the COVID unit, yeah, we have to create that clean area. So we have to actually take a room away and make that the clean area, and then the dirty area where the residents would come from the hospital and through and into the COVID unit. That's really the biggest changes when they're having to do the full PPE. But I know all the staff tell me, when they go home, they all change in the garage And then the clothes, you know, they all go into the washer right away, and then they go in the house and shower. So that's pretty much anybody who's on the COVID unit does that.
Right, makes sense. Any other ad hoc changes that you had to make, Brian?
No, I mean, we follow, you know, the typical guidelines and protocols to keep everybody safe.
Well, it looks like there are a couple other unanswered questions here, and I do think we can sort through them and hopefully get some specific answers out to you all. I do think we are hitting up against our window. I would like to personally thank all of the panelists who I think are all wonderful impact to today's conversation, and I'm actually glad that we assembled such diversity, because I think you've made it all quite interesting and valuable. So thank you all.
Thank you, Dan.
Thank you, everybody.
Thank you.
Pleasure.
Everybody have
So
a
with
great day.
that, I will say to the audience, we will be sending out a recording link to this, as well as some resources. And on behalf of NK Architects, and I think the rest of the panelists, thank you all for spending your lunch with us.
Thank you.
Thank you, Dan. Appreciate it.
Okay.
Thank you. Have a good day and happy holidays.
Yes,
Thank you.
thank you all.